Samuel Hahnemann, born in Germany in 1755, stands as a pivotal figure in medical history. He is recognized as the founder of homeopathy, a system of medicine that has sparked both fervent support and heated debate for over 2 centuries. Hahnemann's revolutionary ideas challenged the conventional medical practices of his time, leading to a paradigm shift in how some viewed health and healing. His influence continues to resonate today, with homeopathy practiced worldwide. Hahnemann's journey began with a deep fascination with the human body and a desire to alleviate suffering. He pursued a medical education, excelling in his studies and quickly gaining recognition for his intellect and dedication. However, he soon became disillusioned with the often harsh and ineffective treatments of the time, prompting him to seek a gentler, more holistic approach to medicine. This quest ultimately led him to develop the principles of homeopathy. Hahnemann's contributions extend beyond the specific practices of homeopathy. He emphasized the importance of understanding the individual patient's unique symptoms and constitution. This patient-centered approach challenged the one-size-fits-all mentality prevalent in conventional medicine of his era and paved the way for a more personalized approach to healthcare. His emphasis on the body's innate healing capacity also foreshadowed modern understandings of the immune system and the importance of supporting the body's natural defenses. Hahnemann's groundbreaking work continues to inspire debate and discussion, shaping the evolution of medical thought and practice.
Samuel Hahnemann was born into a modest family in Meissen, Germany. From a young age, he displayed a keen intellect and a thirst for knowledge. His parents recognized his potential and encouraged his academic pursuits, providing him with opportunities to excel in his studies. This early emphasis on education laid the groundwork for his future accomplishments in the field of medicine. Hahnemann's early education focused on languages, including Greek and Latin, which proved invaluable in his later medical studies and translations of scientific texts. He developed a strong foundation in the sciences, demonstrating a particular aptitude for chemistry and botany. This broad knowledge base would later inform his understanding of the natural world and its potential for healing. He pursued his medical education at the prestigious University of Leipzig, where he quickly distinguished himself as a brilliant student. His dedication to learning and his critical thinking skills earned him the respect of his professors and peers. He immersed himself in the study of anatomy, physiology, and the prevailing medical theories of the time. Despite his academic success, Hahnemann grew increasingly dissatisfied with the conventional medical practices of the late 18th century. He witnessed firsthand the often harmful effects of bloodletting, purging, and the use of toxic substances like mercury. This experience sparked a deep desire to find a more effective and humane approach to healing, setting him on the path toward developing homeopathy. Hahnemann's disillusionment with conventional medicine deepened as he began his own medical practice. He observed that the prevailing treatments often exacerbated patients' suffering rather than providing relief. The reliance on harsh and often dangerous methods left him questioning the efficacy and ethics of the medical practices of his time. He became increasingly critical of the prevailing medical dogma, which often focused on suppressing symptoms rather than addressing the underlying causes of illness. He believed that the body possessed an innate ability to heal itself and that the role of the physician should be to support this natural healing process. This philosophy formed the cornerstone of his later work in homeopathy. A pivotal moment in Hahnemann's journey occurred while he was translating Cullen's Materia Medica, a standard medical text of the time. He questioned Cullen's assertion that cinchona bark, used to treat malaria, was effective due to its bitterness and astringency. Hahnemann experimented by taking small doses of cinchona bark himself and observed that it produced symptoms similar to those of malaria. This observation led him to formulate the principle of like cures, like the foundational concept of homeopathy. He hypothesized that substances that cause certain symptoms in healthy individuals can cure those same symptoms in sick individuals when administered in highly diluted form. This marked the beginning of his groundbreaking work in developing a new system of medicine. Hahnemann's experiment with cinchona bark sparked a revolution in his thinking about medicine. He began to systematically test various substances on himself and healthy volunteers, meticulously recording the symptoms they produced. This process, known as proving, became a cornerstone of homeopathic practice. He compiled his findings into the Materia Medica Pura, a comprehensive compendium of the effects of various substances on the human body. This work served as the foundation for homeopathic prescribing, providing practitioners with a detailed guide to matching symptoms with remedies. Hahnemann's work challenged the prevailing medical theories of his time, which often attributed illness to imbalances in the four humours: blood, phlegm, yellow bile, and black bile. He proposed a more dynamic and holistic view of health, emphasizing the interconnectedness of the mind and body. The birth of homeopathy marked a significant departure from conventional medicine, offering a gentler and more individualized approach to healing. Hahnemann's emphasis on treating the whole person, rather than just the disease, resonated with many who were seeking alternatives to the harsh treatments of the time. Section 5. Principles of homeopathy like cures like. The central principle of homeopathy is similia similibus curenta, Latin for like cures like. This principle, also known as the law of similars, posits that a substance that can cause certain symptoms in a healthy person can cure similar symptoms in a sick person. This concept is often illustrated by the example of coffee, which can cause insomnia in some individuals, but can also be used homeopathically to treat insomnia. Hahnemann believed that illness was not simply a collection of physical symptoms, but a disturbance of the body's vital force. He theorized that homeopathic remedies, by mimicking the symptoms of illness, stimulate the body's self-healing mechanisms to restore balance and health. This concept of the vital force is central to understanding the homeopathic approach to healing. Hahnemann's work emphasized the importance of individualizing treatment based on the unique symptom picture of each patient. He recognized that two individuals with the same diagnosis might require different remedies depending on their specific symptoms and overall constitution. This individualized approach distinguishes homeopathy from conventional medicine, which often employs standardized treatments for specific diseases. The principle of like cures like has been a source of both fascination and controversy since its inception. While some view it as a profound insight into the nature of healing, others dismiss it as unscientific and lacking empirical evidence. This ongoing debate continues to shape the discussion surrounding homeopathy and its role in modern healthcare. Section 6. Core tenets of homeopathic practice. Dilutions and individualization. Another key tenet of homeopathy is the use of highly diluted remedies. Hahnemann discovered that by repeatedly diluting and succussing or vigorously shaking a substance, its medicinal properties were enhanced while its toxic effects were minimized. This process, known as potentization, is a defining characteristic of homeopathic remedies. The dilutions used in homeopathy are often so extreme that there is little or no original substance remaining in the final remedy. This has led to skepticism from the scientific community, which questions how such highly diluted substances can have any biological effect. Homeopaths argue that the potentization process imparts a unique energetic imprint on the remedy, which is then able to stimulate the body's vital force. Individualization is a cornerstone of homeopathic practice. Homeopaths conduct detailed consultations with their patients, gathering information not only about their physical symptoms, but also about their mental, emotional, and spiritual state. This comprehensive approach allows the practitioner to select the most appropriate remedy based on the individual's unique symptom picture. Homeopathic remedies are derived from a wide variety of natural substances, including plants, minerals, and animal products. The selection of the correct remedy is based on the principle of like cures like and the individual's specific symptoms. This individualized approach to treatment is a hallmark of homeopathic practice. Section 7. Opposition and challenges. A constant battle. From its inception, homeopathy faced significant opposition from the conventional medical establishment. Hahnemann's ideas challenged the prevailing medical theories and practices of his time, leading to criticism and ridicule from many physicians and scientists. His emphasis on individualized treatment and the use of highly diluted remedies were seen as unscientific and ineffective. Hahnemann's unconventional methods and outspoken critiques of conventional medicine drew the ire of apothecaries, who held a monopoly on the preparation and sale of medications. They saw homeopathy as a threat to their livelihood and actively campaigned against its adoption. This opposition created significant challenges for Hahnemann and his followers. Despite the challenges, homeopathy gained popularity among the public, particularly among those seeking alternatives to the harsh treatments of conventional medicine. This growing popularity fueled further opposition from the medical establishment, which sought to discredit homeopathy and limit its practice. The debate surrounding homeopathy continues to this day, with proponents citing anecdotal evidence of its effectiveness and critics arguing that its effects are no more than placebo. This ongoing controversy has shaped the perception of homeopathy and its place within the broader healthcare landscape. Section 8. Hahnemann's Legacy. A Global Influence. Despite the ongoing controversies, Samuel Hahnemann's legacy remains significant. He is recognized as a pioneer in medical thinking, challenging the status quo and paving the way for more holistic and patient-centered approaches to healthcare. His emphasis on the body's innate healing capacity and the importance of individualizing treatment continue to resonate with many healthcare practitioners today. Homeopathy, the system of medicine he developed, has spread globally with practitioners and patients in countries around the world. While its acceptance within conventional medicine remains limited, homeopathy continues to be a popular alternative therapy for a wide range of conditions. Its persistence testifies to Hahnemann's enduring influence. Hahnemann's meticulous approach to observing and documenting the effects of substances on the human body laid the foundation for the development of the homeopathic materia medica, a valuable resource for practitioners. His emphasis on careful observation and detailed record-keeping influenced the development of clinical trials and the importance of evidence-based medicine. His work also inspired the development of other alternative and complementary therapies, contributing to a broader movement towards more holistic and patient-centered approaches to healthcare. Hahnemann's legacy extends beyond the specific practices of homeopathy, influencing the evolution of medical thought and practice. Section 9. Homeopathy Today. Continued relevance and debate. Homeopathy continues to be practiced worldwide with varying levels of acceptance and regulation. In some countries, it is integrated into the national healthcare system, while in others it remains primarily an alternative or complementary therapy. The ongoing debate about its efficacy and scientific basis continues to shape its role in modern healthcare. Research on homeopathy has yielded mixed results, with some studies suggesting potential benefits while others find no evidence of effects beyond placebo. The lack of conclusive scientific evidence remains a major point of contention between proponents and critics of homeopathy. This ongoing debate underscores the need for further rigorous research to determine the true efficacy of homeopathic treatments. Many individuals continue to seek homeopathic treatment for a wide range of conditions, from acute illnesses like colds and flu to chronic conditions like allergies and arthritis. Anecdotal evidence of its effectiveness persists, contributing to its continued popularity among patients seeking alternative or complementary therapies. The debate surrounding homeopathy highlights the complex relationship between science, belief, and personal experience in healthcare. While scientific evidence plays a crucial role in evaluating the efficacy of treatments, individual experiences and beliefs also influence healthcare choices. This interplay of factors contributes to the ongoing discussion about the role of homeopathy in modern medicine. Section 10. Conclusion: a lasting impact on healthcare. Samuel Hahnemann's contributions to medicine extend beyond the specific practices of homeopathy. His challenge to conventional medical thinking and his emphasis on patient-centered care have had a lasting impact on the evolution of healthcare. His work sparked a broader movement towards more holistic and individualized approaches to healing. His meticulous approach to observing and documenting the effects of substances on the human body laid the groundwork for the development of modern pharmacology and the importance of evidence-based medicine. His legacy continues to inspire debate and discussion, shaping the future of healthcare. While the scientific validity of homeopathy remains a subject of ongoing debate, its influence on medical thought and practice is undeniable. Hahnemann's work challenged the status quo, prompting a re-examination of conventional medical practices and paving the way for more patient-centered and holistic approaches to healing. His emphasis on the body's innate healing capacity and the importance of individualizing treatment continue to resonate with healthcare practitioners and patients alike. Samuel Hahnemann's legacy as a medical innovator and a champion of patient empowerment continues to shape the evolution of healthcare.